Hello friends, let us now learn some important points about personality disorders. So in the personality disorders, first personality. Personality is a dynamic organization within the individual. It gives unique adjustment to the environment. So personality gives unique adjustment to the environment. Then there are five broad dimensions or personality traits. Five broad dimensions or personality traits include 1. Openness to experience. Some people are openness to experience, that is, they are curious and they are novelty seeking. Then consciousness, that means conscientiousness, that means they are well organized and disciplined always. Then we have people who are extraversion, that is, they are social, very social, they are talkative, they prefer in group activities, that is extraversion. Then the next type of personality trait is agreeable, that means they always are in cooperation with others, for others, they are okay for others. Then we have neurotism. Neurotism is tendency to experience unpleasant emotion easily. They easily get sad, that is easily, that is emotional instability. It is instability, not stability. Then now these are the normal personality traits. Now let us learn about personality disorders. Personality disorders is abnormal behavior. It is seen in almost 10 to 20% of patients. These personality disorders are present most commonly in the adolescent age group. These are egocentric, that is, these are agreeable to oneself. So if we see the types of personality disorders, according to DSM-5, these personality disorders are classified into 3 clusters. According to DSM-5, they are classified into 3 clusters. So first we have cluster A personality disorder. In cluster A personality disorder, here this is called as schizophrenia continuum. Here the patient is odd eccentric. He is between normal and schizophrenia. Here the patient is odd and eccentric. First, paranoid personality disorder. So in paranoid personality disorder, the patient has excessive suspicious and he distrusts, and he has excessive suspiciousness and he has distrust to others, that is, he does not trust anyone. He often complains to police for small things, even for smallest of the smallest things in life. He starts to complain to the higher authorities. He is extremely sensitive and keeps grudges for a longer period of time. He has importance to self. He gives lots of importance to oneself. Right? That is paranoid personality. Second is Sizoid personality. In Sizoid personality disorder, here the Sizoid personality patients are detached from the social relationship. They have highest level of introversion. And they prefer doing solitary activities only. They are emotionally cold. They do not have lots of friends. They do not have many friends, and there are in the Sizoid personality disorder, these patients have very few activities give pleasure to these patients. Very few activities give pleasure to them. They have very little interest in sexual activity. So these patients, if they develop schizophrenia, this will lead to poor prognosis of schizophrenia. Then we have the third type of personality disorder, which is called as schizotypal personality, typical personality disorder. In schizotypical personality disorder, the patient is odd and eccentric with magical thinking. Like a child, he thinks magically, and he also has fears and fantasies like a child. He has the strange ways of communication which are very difficult to understand. These patients also report illusions. So that is schizotypical personality disorder. Then we have cluster B or attention seeking behavior. So these cluster B or attention seeking behavior are again divided into 4 types. In cluster B or attention seeking disorders, first we have narcissistic personality disorder. In narcissistic personality disorder, there is increased sense of self-importance. Here the patient believes that they are special and talented. The patient has fantasies of unlimited success and power. The patient has fantasies of unlimited success and power. He has fragile self-esteem and he is susceptible to depression when faced with rejection. He has fragile self-esteem and susceptible to depression when faced with rejection. If condemned, he will be very angry. He will be very angry. He always boasts off about himself. So this is about narcissistic personality disorder. Then the next personality disorder is histronic personality disorder. In the histronic personality disorder, we have the patient in this histronic personality disorder is extroverted. He behaves dramatically. He is extroverted, behaves dramatically, excitable and emotional. He wanted to be the center of attraction always, and he exaggerates everything. Then the person is sexually seductive and he puts lots of makeup and he uses physical appearance to draw attention to self. They uses physical appearance to draw attention to self. Then we have the third one, which is antisocial personality disorder, or also called as dissocial personality disorder. Here in this, the patient does unlawful behavior like theft or lying. The patient does unlawful behaviors like theft or lying. The patient does not have any guilt or he has no empathy. He never learns from his previous mistakes. In antisocial personality disorders, in this, the most commonly you will see substance use disorders are most commonly seen in this antisocial personality disorder. Then the fourth one is borderline personality disorder. These borderline personality disorder, these will almost always comes in the state of crisis. These borderline personality disorders almost and always comes in the state of crisis. Here the patient has significant mood swings. He has unclear self-image and goals. The patient is intense but shallow emotions. He has black and white view for all the things. He has always black and white view for all the things. That means sometimes he is excessively dependent on close person, and if he is sometimes excessively dependent on close person. Once he finds that he is not up to the mark or has done some mistake, he will be hostile to that person. So this will land him up into unstable interpersonal relationships. He will have unstable interpersonal relationships. Then slowly he starts doing repetitive self-destructive acts like slashing of wrists or overdose of medication is taken by this patient. This is done mainly to elicit help from others and to express anger. Then he has impulsivity in some areas. He is impulsive in some areas like spending money, sex and substance abuse disorders. In these cases, he is very impulsive. He has low frustration tolerance and poor coping up of skills. So in borderline personality disorders, the patient has unstable interpersonal relationship with significant mood swings. This borderline personality disorder is the most common cause of suicidal attempt or para-suicide. The drug of choice for this borderline personality disorder is SSRIs, that is selective serotonin reuptake inhibitors, are given in high doses, or we can do dialectic behavioral therapy. Then we have cluster C personality disorders. In this, the first one is avoidant personality disorder. In this avoidant personality disorder, the patient they are excessively sensitive to rejection, and they are afraid that they would be criticized or rejected in social situation. The patients are excessively sensitive to rejection and are also afraid that they would be criticized and rejected in social situation. They are socially withdrawn people. So these avoidant personality disorders are socially withdrawn people. They are unwilling to enter into a stable relationship. They do not wish to enter into a stable relationship unless strong guarantee of uncritical acceptance is given. Unless someone accepts them, they won't enter into a stable relationship. That is avoidant personality disorder, where they always have rejection and afraid to be criticized. Then we have dependent personality disorder. In them, they are always dependent on others, as the name says. Then third, there is obsessive compulsive personality disorder, or also called as anarchistic personality disorder. In this obsessive compulsive personality disorder or anarchistic personality disorder, they are always punctual, perfect. They go through rules and regulations always. They are systemic, moralistic, and they have rigid form of thinking. They are always formal and they look serious always. They lack sense of humor. They are excessively devoted to work. So because of this punctual perfectionist, so this will put the patient in the risk of depression. There is no risk of obsessive compulsive disorder in future anyways. Now the next important thing is about the classification of personalities. Personalities can be classified into three types. One, we have type A personality, B and C. Type A personality are competitive. They are time urgency, workaholics, ambitious patients. So they are always have risk factor of coronary artery disease. Then type B patients are relaxed and non-competitive. They do not have much competition. Then type D personality disorders are negative affectivity. They have social inhibition and they are predisposed to the development of coronary artery disease. So these are the important points about the personality disorders. Thank you for watching. Thank you.